Hi, I'm Dr. Zac Cartun, co-founder and chief medical officer of Stride Soles. If you care about your feet, and you should, you'll find that there's no shortage of advice out there about what the best type of insole is for your foot, activity, and performance goals. Just ask anyone working at a shoe store, podiatry office, physical therapy clinic, even your general practitioner. They'll all tell you different things. So let's dive into the evidence, unpack when custom or custom orthotics are the right choice for you, and learn a little bit about how to make your movement goals a reality. When designed correctly, custom orthotics are much more than just fancy shoe inserts. They stabilize and realign your feet, ankles, knees, hips, lower back, and even for some people, all the way up to their head and neck. Of course, this requires proper design by someone who understands the body mechanics and how a subtle adjustment in the feet can affect everything up the kinetic chain. But there's quite a list of things that custom orthotics can help with beyond just pain, and I wrote a list down just so I don't forget anything. So of course, they can reduce muscle fatigue. They support the soft tissues in the feet and ensure that your muscles are well activated but not overused. They help active people like runners, lifters, and athletes stay injury-free. Injury prevention is huge. Reducing strain is also a key point of what custom orthotics can do. When you have an injury or you aren't walking correctly, your body compensates, and that compensation causes unnecessary strain. Obviously, they ease all sorts of pain, but especially chronic pain. So people who have arthritis, plantar fasciitis, or even diabetic neuropathy benefit from custom orthotics. And lastly, and most importantly, they make movement comfortable. They ensure that you're moving the way that's physiologically designed, and that can only mean one thing, which is pain-free, comfortable movement. Not every orthotic is a magic fix. It really depends on who you are, what your pain conditions are, and what your movement goals. Given that orthotics can be pricey, it's important to understand that not everything can be treated with custom orthotics. And on the flip side, overuse of custom orthotics can lead to muscle atrophy. So just imagine those really rigid plastic insoles that a lot of podiatrists prescribe in the United States. It's kind of like a cast for your foot. It doesn't allow your foot muscles to really activate. And if you ever had a friend that had a broken bone, a broken arm, for instance, they wear a cast. And after 2 months, you look at their arm, the one that was broken compared to the healthy, and all the muscles have shrunk. And the same thing can happen if you wear custom orthotics that are improperly designed or too rigid for too long. So the real question is, why are custom orthotics so pricey? You are right to suspect that the materials alone are not that expensive. Some people say it costs around $100. In our case, it's less than $100. Really where the value comes in is how they're designed. In our case, we have a team of licensed clinical podiatrists that have, I think, as of today, have made over 500,000 pairs as a team of custom orthotics for people from your average gym goer to professional athletes. We've made custom orthotics for professional cyclists, soccer players, golfers, runners, you name it. Another thing that you're paying for is the technology, and it's actually kind of an inverse technology. So the less innovative the custom orthotic is, typically the more expensive. So on kind of the lower end of the spectrum, you have plaster casts of the feet that are then manually transcribed onto a milling machine where they're hand milled, and the custom orthotics are then built and sent to you. Those tend to be very expensive just because of the labor that's involved, not because they're necessarily better. Then on the other end of the spectrum, like Stride Soles, you have a 3D foot scan. That foot scan doesn't need to be shipped like a foam box or a plaster cast would be. It gets sent directly electronically to our podiatry clinic. Then it's designed using CAD software, so there's no kind of hand labor process. And then the construction is 3D printing. It's just a click of a button, and all those cost savings are transferred onto you. And that's why we can offer such competitive prices despite having among the most experienced podorthists and podiatry designers in the world. And finally, custom orthotics versus over-the-counter insoles, the age-old debate. I'm going to save you a lot of speaking and talking to give you the short answer. Whatever works best for you is best. I find in my experience that a lot of our patients have tried something over the counter, and typically it doesn't offer support in a long-lasting and corrective way. It's more like walking on a really thick piece of gel or cushion that feels good for a couple days, but over time that cushioning wears down, and whatever kind of latent injury or incorrect stabilizing processes happening in the feet that previously existed prior to orthotic use just tend to return after a few days or weeks use of over-the-counter insoles. When custom insoles are designed properly, they actually correct whatever underlying architectural issues are in your feet, and even though they may cost slightly more, or in some cases significantly more than over-the-counter insoles, they provide a long-lasting benefit for both pain relief and injury prevention that it's very hard to put a dollar sign on. So whether you're an athlete, a teacher, or someone just looking to get a little bit more movement in their day-to-day, consider custom orthotics and get evaluated either by your podiatrist or head to stridesoles.com, where we can help you remotely, save a trip to the podiatry office and save you a lot in your wallet to get the most, world's best custom orthotics.